Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you on this rainy, wet, but spring Monday morning here in Kansas City. We are broadcasting live with you from the Dulce Simons Family Studio. And what a good day it's going to be, because we have some really special guests, Doc Hawk.
Yeah.
You want to introduce these two special guests that are right behind you, just in case?
Yeah. So we have Wyatt, my son. He's 14, middle school. Will be a freshman.
Welcome, Wyatt.
And Caroline, who is 12, who just turned 12 a couple months ago.
All right.
In 6th grade, will be going into 7th grade as well. So they are ready for vaccination.
And are we going to perhaps witness this momentous event right here on the Morning Media Update?
Absolutely.
Awesome. That'll be at the end of the program, so hang out, because you're going to see a 14 and a 12-year-old get some vaccination, and that is a big deal because, as we know, vaccines are now released from Pfizer for this age group.
Yep, correct. 12 to 15. So now anybody 12 and older can get the Pfizer vaccine. I think it's important because we do understand and know that there is so much misinformation out there and disinformation campaigns going on. We know there's just a lot of false stuff going on. So we really want to continue to let people know that these are safe. There is no concerns about infertility or shedding of the virus or shedding of the spike. The vaccine will not give you the illness. The vaccine components are taken up locally in the shoulder, and then the only other cells that really see them are the immune cells. They don't get to the respiratory tract or the GI tract, so there's no way you can actually shed virus or spike. Completely safe, and most importantly as well, very good and very efficacious at protecting against disease.
So over 1 billion doses of vaccine administered across the globe, and so far looking incredibly safe.
Absolutely.
It's going to be safe.
Yeah.
Hey, before we go to the numbers, let me introduce two other great folks here with us today. Dr. Giovanna Ross, who is the Director of Early Learning for the Mid-America Regional Council, and John Jaffe, System Vice President of Human Resources here at the Health System. They're going to walk us through some significant changes and questions they are getting in the community as we go back to work, because COVID-19 has changed the traditional workplace for many occupations, including caregivers, and now there's this beginning cry. We've heard it here in the health system and everywhere. We'll talk more about this, that people are beginning to return to work instead of working from home. But first, Hawkeye, how are we doing? Actually, I know we're doing better.
Yeah, we're doing a lot better. You're exactly right. You know it all the time, but you tease it very well. So 9 active infections, 4 in the ICU, only 1 on the ventilator, and 10 in that recovery period. So 19 total, under 20 total for infections. Hays has 2 active and 1 in that recovery period. And I'd just also like to say, we had mentioned last week, but our last deaths were on 5/16, and we had 2 deaths on that date. But prior to that, it was actually May 4th.
So things are going better overall. We've gone from 20 or 27 acute cases, I think, early last week, down to 9. I like that. What do you think is the cause of it?
You know, I think that's good. It's hard to say. We still know that overall cases are decreasing, so that's good as well. It's really difficult to say exactly what it is.
I'm going to bet it's more vaccination, more key groups getting vaccinated, and people who have been vaccinated have beginning to mature in their vaccine. They're at that 6-week mark of Moderna, Pfizer, 2-week mark after J&J. I think that shows us that things are getting better throughout the United States. And we, as you said, we've seen that data nationally. We're seeing the rates in New England, Massachusetts, New York, New Jersey. We're seeing the rates in Michigan. We're seeing the rates across the country fall. Unfortunately, I think the rates are starting to fall in India as well. So really good news. And also a really good interview this morning. We're going to have to turn our attention to worlds and countries that don't have enough vaccine. I was listening to the New England Journal of Medicine podcast from last week. They interviewed the head of essentially the NIH in South Africa. She was talking about the challenges they face with not enough vaccine, lots of underreporting, and really pretty severe COVID-19 there as well.
Oh, yeah. You know, we do, again, you're only as strong as your weakest link. We know that there are incredible supply chain deficits all around the world. We know that there is incredible suffering. People can't even get into hospital beds, hospital rooms. It is very different in other parts of the world, including India, compared to here. We have that ability, and we have the supply of vaccine. Let's get all of our citizens vaccinated, but also let's try to support these other countries and get vaccination to them as well.
Yeah, very important. All right, let's first see if there are any reporter questions here on the line.
Good morning. Cody Holyoke with Channel 9.
Cody.
Cody.
Happy Monday.
Happy Monday.
Over the weekend, we saw a number of school districts come out with changes to their masking policies. A number of them were saying, okay, CDC is out with new guidance, mask policies are being lifted elsewhere, but I'm seeing many saying you don't have to wear a mask even if you're not vaccinated. I understand there's outside pressure that districts are facing, but from a health standpoint, is this the right move?
You know, here's what I would say. The CDC system is an honor system, clearly.
Yeah.
And just if I'm going to stay in our medical lane, and Hawkeye and I both will take a swing at this, if we're going to stay in our medical lane, I think it's safe to say, we would say, if you've not been vaccinated, the new guidance does not apply to you, and you should stay masked, because you're very likely to transmit the virus, to get the virus, to transmit the virus, and to injure others. So I don't have hesitation in saying, if you've not been vaccinated, you should be masked. Mm-hmm. That we know to be true. That's just based upon the guidance that has already come out, and we know that that's true from just how this epidemic has worked.
Yeah, I mean, the key component to that guidance is for fully vaccinated people. But we understand that a lot of parts of the population, segments, subgroups of the populations are not vaccinated yet. So you have to take that into account, understand that in your surroundings and where you're going. And certainly we know for children, again, it's only been, the Pfizer vaccine has only been approved for those 12 and over. So those are the youngest kids that are starting to get it. So everybody else is unvaccinated. I think it's important to know that all of the other studies that have come out to show that there's not much spread in the schools is because of those other mitigations factors. Vaccination of the adults in that school when vaccination was available, but also distancing and masking as much as possible. Now, luckily, we are getting to the end of the school year, so hopefully from now until the next school year begins, we can get all those young children vaccinated.
Speaking of good science and research about this very question, we took a poll here at Very Scientific during the Morning Media Update program, and it demonstrated, as of on Friday, we asked a question about the new mask guidance. Are you feeling confident or feeling concerned? 24% of our audience said confident, 76% said concerned. So the path to getting people confident is get a vaccine. Absolutely. So we think this is really important, and we just wanted to kind of reiterate how important that really is. Make sure you get vaccinated, feel confident. So this weekend, I went out to the grocery store. I wore my mask, a little shopping, wore my mask.
Yeah.
Because, you know, I still want to feel extra safe when I'm in those places, and maybe I don't need to. But I would also just note that I haven't been sick in over a year. I mean, the last time I was sick was when I had influenza back in January of 2020. You know, that's not bad. That's pretty darn. So I don't know. What do you think, Hawk?
Yeah, I mean, I think, you know, feeling concerned is certainly reasonable, unless you can understand that 80+% of the population, of the whole population, can be vaccinated, because then you're certainly decreasing the amount of people who are unvaccinated. So I think it's really key to understand that there still is, you know, a fairly large group of people, a fairly large segment that is unvaccinated. So I think you still need to take precautions for yourself individually, for you and your family, when you go out to these places.
All right, good news there. All right, Cody, other questions?
Yeah, quick follow-up.
Please.
Just as we look ahead to another school year, and hopefully a more quote-unquote normal one, could you clarify what's the timeline for kids under 12 getting access to the vaccine?
You know, we heard from Dr. Bahoud last week, I think, and she was saying that it looked like more towards, I believe it was an August or September date when we were going to get the next wave of results. Is that what you remember too, Hawk?
Yeah, I think, but we also know that all of these trials have been expedited, and they come out with new timelines, you know, every so often. So it could even be before that. I think it would be great if it were maybe July. That way you give all that time to start getting first doses and second doses prior to school beginning. But you never know. You know, Operation Warp Speed has shown that they are able to increase and expedite the time, analyze the data, make sure it's safe and efficacious, but hopefully it'll be before then.
All right. Other questions?
Charlie Keegan here from 41 Action News. Good morning.
Good morning. How are you?
I'm okay, thanks. I've got
Good.
more of a fun question for you. Since you guys have been doing these meetings and whatnot, are you getting recognized out and about? Do people stop you, Doc Hopper, and get your kid at the grocery store and say, hey, I saw you on TV? And what kind of response have you got from the general public?
Yeah, you know.
Well, people know you, Hawkeye?
Yeah, I get stopped even when I'm masked in stores, and you know, it's a little daunting, but hopefully that means they're watching the show and they're getting our message and getting it out to their friends and family as well, and continuing to endorse those messages that we're giving, those medical messages to keep people safe. So yeah, my kids kind of get embarrassed sometimes too.
Well, I've been recognized a few times, mostly by people I already know. So I don't know if that's recognition or not. And my wife was the first to remind me. She goes, "Okay, remember, Stephen, you can't act like such a dork in public anymore because people may know who you are." I'm like, "No, I've been invisible for a long time. Why not now?"
Yeah, right, I know. Soon. We will return to that.
Yeah,
at
we hope
some
so.
point.
Hey, Charlie, I want to add something to that, too, and how the doctors respond. In all seriousness, when we first started, you guys were not necessarily comfortable in this skin of being public announcers because of being doctors. And they used to ask me every day, is this the right thing? Are we doing the right thing? Do you think what I'm doing is should we keep doing this? You want to talk a little bit about that in all seriousness?
Yeah, when we first started doing it, the whole health system debated whether or not we should go out there and talk about this because we're like, we don't want all the COVID patients coming here. If we start saying it to everybody, we're experts in COVID, everybody's going to want to come here. And so we had to get past that and say, no, wait a minute, this is for the public good. We want to try and educate people. We want to try and make sure we talk to people about how to stay safe, which is one of the reasons we've made sure we've involved other chief medical officers and other physicians from other hospitals so that we can say, look, we're all in this together, and to make sure everybody knows that we're trying and working hard together. And by the way, your chief medical officer group in Kansas City is outstanding. But I think that you and I had a long history of speech and debate in high school and college. It made it a little easier, but even this is a different thing.
Yeah.
Speech and debate, small audience, you're up there, you're just talking. I'm real comfortable yapping in front of people, but yapping in front of cameras is a little different. So all you real broadcast people out there, well done. You guys work hard.
Yeah, absolutely. And it was a little bit easier for me just because I was able to stick with the science. And of course, we knew early on there was hardly anything that was coming out. Certainly as we got to have more science, more publications on a daily basis, it gets a little bit more difficult to keep up with the literature, but we still try to do it. We still try to, certainly if I'm seen out in the community, always giving continued messages of doing the right thing and trying to set that example for people around the community as well.
Yeah, you see, Charlie, the hardest part of this whole thing, see this bright, shiny forehead? Back at the beginning of the pandemic, when we didn't know as much, they would powder my forehead to try and keep the glare down, and now they don't do that anymore. So now you just get the bright, shiny reflection off of my bright, shiny forehead. Other questions?
You look good, man.
Oh, thank you, brother. Thank you.
Betsy Webster with KCTV5 sent some in. You've answered most of them, but we have a couple that she has to follow up with. One of them is, what children are most at risk from COVID? She's wanting to know if there are groups like there were with the adult population, like comorbidities and such. And she also asks on that point, can children be a breeding ground for variants?
The answer to that question, I think, and Huck and I can both take a swing at this. First part, who's most at risk? Those kids are just like adults. In this case, those who have chronic underlying health issues clearly don't do as well, like sickle cell anemia or cancer or a transplant. So it's really the same story about who's not going to do as well. Those who may have primary immune disorders. And I think the second question is, can children be a place where mutants arise? Absolutely, because they're still going to reproduce, Hawk.
Yeah, yeah.
Not the kids, that is. Well, the kids are going to reproduce someday in their lives. Man, I'm in a hole on this. I got to get out of it. What I was really trying to say is the virus can reproduce inside the children.
Yeah, and we've had an extremely low number of deaths from children, thank goodness. But even one is too many. I would certainly like to deep dive into those demographics and see, do they have underlying immunosuppressants? We thought asthma was probably an issue, but it turned out not to really be a risk factor. But I believe that other immunosuppressive conditions, just as you mentioned, probably are, but that's for death, hospitalization, the inflammatory, multi-system inflammatory, all those things are bad and can happen to children of all age. But luckily, what we know is that certainly the younger the population, the higher their chance of not having any significant problems at all. So that is a good thing. But they can certainly still continue to spread the disease to other people. And there is that chance for variants to arise as well, especially if maybe they are immune compromised and they have a longer course of that viral stage of disease as well.
And the last question for media is also from Betsy Webster this morning. And she wants to know, we noticed that Blue Valley Schools has a job posting for a contact tracer. How unusual is that? And what do you think about it?
I honestly don't know much about it. And so, do you know much about that, Hawk?
I don't. We know that the health departments were working
Doing
extremely hard to do contact tracing, and that was one of the components in the mitigation strategies as well. So, again, that's county health departments. Not really sure about the
schools.
The local school
Yeah,
districts.
I would think that one trace for all the Blue Valley schools could potentially get overwhelmed. But I like the idea where they're headed, which is we're going to take care of the kids, we're going to take care of our families, we're going to use the person to contact tracer. Maybe we can kind of dig into that a little bit more and go learn a little bit more about that. So
You got it.
all right. So let's turn to our guests now. I'm going to start with Giovanna. We're going to start with you. Tell us a little more about what you do at the Mid-America Regional Council and how the pandemic has changed your job. And by the way, are you at home or are you in your office right now? Or is that a
I am in my office. I split between my home and office, and today happens to be a day that my kids are at home doing their AMI day, so they work at home on Monday. So I tend to try to come to the office when I have a lot of meetings that I need to get done. But I work within early learning, and so we do work around systems building to help to increase the access to affordable childcare and early learning programs for individuals in the greater Kansas City region. I also, we have the Head Start grant for Clay, Platte, and Jackson counties, and so we work with 17 agencies to deliver Head Start programming to about 2,400 children and their families. And so those two pieces have really changed over this last year, moving towards helping caregivers to understand all the guidelines that are coming out, both from the CDC, from the state, from the local health departments. We've done some work to put out guides to child care programs for that. We've also worked directly with the CDC within our Head Start program and the Office of Head Start to talk about mitigation strategies that have been successful. And so we also meet weekly, when we have since last April, with our local licensing departments that are part of our health departments in our Clay, Platte, Jackson, and Johnson, and Wyandotte counties to help to continue to provide webinars and guidance for our child care providers in the community. And so I would say that the work has grown in that we have different areas of focus, but also have brought really our network together and stronger, and providing those opportunities to have conversations sort of like what you all are doing every day, maybe not as much frequency on our end, but just bringing them together to help with the decision making. It can be really lonely to try to make decisions about your childcare program. And so bringing them together has really helped their work tremendously.
Well, I bet that's true, because that work has had to make a major impact, because those caregivers, child care workers, et cetera, man, the rest of us can't go about our jobs without them. So thank you for doing that. What are some of the ways that employers can support caregivers that continue to work from home?
Well, I think some of the things that we have to know is that one thing that's changed is those boundaries are now intermingled. So like I said, I came here today because I knew I had a full day of meetings, because sometimes when the kids are at home, they're in the background, the dogs are in and out, and it's really it's hard to separate that. So part of it is having those understanding of that competition for attention. And so that might mean that we have to offer some flexible work hours. And so it's not 8 to 5 or 9 to 5 or anymore. Part of it is, how do we focus on the results over the routine? And so being strategic about the wonder of face-to-face working. Sometimes we have that mentality that we have to be seen in order for it to feel like we're getting our job done. But instead, we have to start to think about, what does face-to-face benefit? And then what are the things we can do over Zoom or Skype or whichever medium we're using. And I think one of the key pieces within that flexible working is that the leadership is really signaling it's okay to have unconventional hours. I have young children, many of the people in my department do as well. So modeling that there are times that you need to work at different times of the day than just that core 8 to 5. I think the other thing that has been interesting is this idea around giving caregiver alerts on our calendars. we all use some sort of electronic calendar. So using our calendars so that when people are looking for meetings, we can block off, well, this is the time that typically the children are getting their meals or their naps, or if I'm caring for a parent in the home, these are the times that I'm not available for meetings. And so making sure that others know that when we're doing scheduling. And also, I think we have to acknowledge that when a kid or a dog or a cat or something pops up in the background, acknowledge it. Say hello. I think one of the great things of this has been that we have seen babies be born and then they're like a year old and we get to see them, whereas we wouldn't have been able to do that in the past. And I think another strategy that has impact is to cultivate opportunities to connect. So, meetings are great and having an agenda is great, but it's also nice to find a time that individuals can come together for a coffee hour or just a chat. And we've done that here at Mark throughout the pandemic. We've had individuals that have led conversations. They just send out an email and say, hey, if you're free 2 to 2:30, we're going to be on this Zoom link. So join us just for conversation to try to recreate those organic conversations that you would have when you're all together in the office.
Those are great points, and I love that point too. Recognizing people when they're at home. Years ago, because I'm approximately very old now, Cokie Roberts, who's an NPR reporter, was on the line. This is when I first started listening to National Public Radio back in the 80s or early 90s. And Cokie Roberts was on the line, and NPR wasn't that old at that point for Morning Edition. And you could hear her dogs barking in the background. She had obviously called in from home to do the thing. And I thought, that's the best part. I love that. So now when people's cats walk across the screen or you hear their dogs barking, all I can think about is the song. Who let the dogs out? Who? Okay, John Jaffe. Man, when we first started having people go home because of the pandemic, it was like, go home and work. It wasn't a plan to work from home. So talk to us about how that's evolved over the year and what we're doing differently now.
Yeah, so, we really had to rethink, especially being in the business of healthcare, unlike a bank or other businesses that, maybe had the opportunity to build strategies to be at home before. We had to rethink, a lot of those strategies. So, we had to start with things like orientation and recruiting. We weren't going to do big job fairs anymore. We weren't going to bring 100 people into an auditorium anymore. So that began the process of building new tools and new opportunities for us to educate our workforce and bring people in. And then with that just came the idea that we've got a number of functions in the healthcare system that, can be done from home, can be done well. And so our IT team stepped up. Our marketing team stepped up. We brought in new tools and enabled people to be at home. And what we found is we've been very successful at it. We do have a lot of concerns about connectivity, as your colleague had mentioned in a previous question, about keeping people connected to the mission and what we do. Being a care provider is a very personal business, and most of us have chosen this business, even though we're not caregivers like you all. We choose this business because we love to be around people like you all. And so being at home all the time, creates its own unique challenges. But absolutely, we've got almost 3,000 employees that generally are in and out of home, working from home mostly, and occasionally come to the office as opposed to the other way around. So, it's been a really unique challenge, and I think the organization has stepped up to it.
What do you think that this is going to mean for the national workforce and the healthcare workforce specifically?
Yeah, what it's done is enabled us to be flexible in terms of how we think about, working with our employees, and it enables us to recruit people also differently, because before, where you need to live in Kansas and Missouri, right, so you can get to the hospitals or get to your care sites to deliver care. Or to be a part of a support system. And now we have employees in Florida, New York, California, Nevada. And so some of our IT teams and our marketing teams can work in a variety of different ways. And we've set ourselves up very successfully to be able to manage that. It opens up our workforce. We get some very talented people. We've even had a few employees that were essentially retiring or going to a different stage of their career and moving to a different part of the country, but we were able to keep them part-time or keep them engaged with us, and you don't lose all that knowledge that they brought to us. So it's been a great learning for us, and I think it's going to change the dynamic of how we do work in the future. And of course, our technology is going to be really important to continue that.
I think that's right. Mm-hmm. So, okay, I'm going to ask you both this, Dr. Ross and John. How do we combat the feeling of being disengaged when you're at home, or the loneliness, the isolation that can go along with that? Dr. Ross, thoughts?
I think one of the main things is just reaching out and having those conversations about what's going on. You know, what do you have going on? We have scheduled check-ins, but then sometimes we kind of laugh. We said, we'll hit you up by Skype, you know, hit me up by Skype. And having, instead of just picking up the phone, picking up the where you can actually see each other on video, I think has been helpful as well. And I think the other piece is that as more people are coming back into the office, making sure that if you are having hybrid meetings where some are together and some are at home, that you're actually setting it up so everybody is engaged and making sure that your comments and questions aren't just focused to the people that are right there in front of you.
Yeah, that makes sense. And John, thoughts?
Yeah, so I think the isolation is a real concern. I think we initially enjoyed the movement. Many of us didn't enjoy not commuting and it had some of the benefits of that. And now what's happening is just being on 9 or 10 hours of Skype meetings has become tiresome. It's and become, it's not as connective. In many ways, it's not as fun to be, to be with people. And to just do it virtually. And so we've had to get really creative about, how do we even run those meetings? And so I think many of us worry about the mental health of people, being at home all the time and all that isolation. And I think we're just going to have to try to find, in my opinion, find a balance that makes sense so we can get people connected again, whether it's, we miss the recognition events. We miss going to dinners afterward as a team. We miss all those human connections that we all want at work. And so how do we find that balance between allowing people the flexibility and the safety of being at home as the virus is still, going on, and connecting them to the humans that work here?
Yeah, I think it's that balance. I think understanding that balance of working at home, which has been a blessing and a silver lining. I have a friend at home where I'm from who has a child with special needs, so it's allowed him to be able to devote more time and presence to that child, and it's been a blessing for him. But it also takes that balance from the employer as well to allow that. And as long as you're getting your work done and you're productive, I think that's a good thing.
All right, Jill, let's see what questions we have from our community today.
Oh my gosh, we have so many today. I know we're not going to get to them because we've had a good discussion and we still have a lot of things to do. So I'm going to try to smush some of them together, okay? Stephen has one that some people are asking. Any chance someone close to age 12 could get the vaccine so they can be free this summer?
No, you can't, because the reality is that the EUA is for 12 and over. So unfortunately, getting close to 12 is not 12, and so you really have to be 12 and older.
Yeah, I think that's more of a legal question. I think physiologically, what's wrong with 11 and a half versus 12? Probably nothing, but I think it's more of the legal question there. Again, certainly, and we have this for other vaccines too. The shingles vaccine, you can't. It's probably safe for people 50 and under, but it's really only approved for those 50 and over. So it's that kind of stuff, and it's more of a legal question than the actual safety or efficacy. But again, we still don't have the data in that age group.
Yeah, and I think that's really the key. Although I think we all believe it's going to work and it's going to be safe. We don't know that yet, and so the EUA is not out, so you can't do it.
Yep.
Dee wants to know, when are we going to need a booster?
Great question.
Yeah.
I think we get asked that question, and our answer is always the same. We don't really know, but I'm going to guess annually. And I think the only reason that would change is that if a variant comes out that the vaccines don't work against. And just to say clearly, again, because they reviewed that this morning in this New England Journal of Medicine podcast, the vaccines work against all the variants, including the South African variant, at least the vaccines that are approved in the United States. Go ahead and get them, but if anything changes, we can modify, especially the mRNA vaccines like Moderna and Pfizer. And Moderna is actually testing a even slightly reconfigured vaccine for the South African or B1351 variant. And I think the answer is it's going to be a year. The vaccines right now all work really well, but if we need to, Moderna's already begun to work on one.
Yeah, I think our answer has been fairly consistent with what we know and what we anticipate. And again, this is all speculation, but probably nothing before a year after the original vaccine. I would look forward to, though, any pivot on that vaccine, say, towards a certain variant or isolate. Certainly right now with the South African. We know that the current vaccines are efficacious, but the efficacy is a little bit reduced compared to the original spike protein used in that original vaccine. But it is still very efficacious in protecting against severe disease and hospitalization and death. But I would certainly welcome, once we are able to get that booster, maybe for some of those more immune system evading variants like the South African variant.
From our cancer Facebook page, Kitty says different cancers have different colored bracelets that denote, hey, I had breast cancer, or I'm supporting someone with breast cancer. She wants to know, is that a good idea for people that have been vaccinated? Maybe we all just need to get bracelets.
Yeah, good question. I don't know the right answer to that
Yeah.
question. I think that becomes a philosophical question. There are so many good ways we can show that you've been vaccinated. We could do it on, your smartphone can carry it. A bracelet's a great idea. You can have a card in your pocket. I mean, there are a lot of ways to do it. I think the real question is, as a society, are we going to make a decision that to really go into things like Arrowhead Stadium or that rock concert or things like that, that you're going to have something to prove that you've been vaccinated, unless you want to wear a mask. And I don't know that we're at a spot of doing that. It doesn't feel like as a society we're going to do that. It feels like we're going to use the honor system, Hawkinson.
Yeah, I mean, I think the honor system, you're absolutely correct. I think it gets hard to police those things. We know that we've seen stories in the media about people getting arrested for forging or trying to forge documents and things of that nature. So I think that makes it very difficult. I think if you wanted to voluntarily wear one, that is certainly reasonable. But again, it all goes back to that individual honor system of, did you actually get it? And I think most people would honor that and be honest. But there are that sub-segment of the population as well that would, if they knew they had to do something so that they get into a venue or do some other activity, they could try to do that as well and not be as honest.
Okay, I'm going to do one more question because we need to make sure that Wyatt and Caroline get their shots. So you guys are up next after this question, okay? And then I promise everyone else we will take your questions and start
Through the week.
Through the week, yeah, because we have a lot of them. But here's a question that many parents on the line have today, and so I'm kind of smushing it together. Lee Summit is one of 2 or 3 school districts that have said, we're not going to have masks anymore. Parents are like, should I continue to send my kid back to school because I felt like it was safe? Now if they take the masks away, are my children safe? They just want to know, what do we do? I can feel the anxiety in their questions today.
Well, let me start with Dr. Ross. What thoughts that you have for the standpoint of Mark on this question?
Yeah, well, what I have done, and I'll just speak from my own experience. My children, we are in the Oak Grove School District, and they went along with what other districts were saying about the mask. And I have told my children, because they are not vaccinated and because the guidance is that you need to wear a mask if you're not vaccinated, that they would continue to wear their masks to school. So I would say from a personal perspective, I'm trying to follow that, as you were saying earlier in the program, just around the CDC guidance is for those that are vaccinated. And so those that are not should continue to wear their masks. So my children will be going to school with their masks. And we had that conversation about why.
Huck?
Yeah, I think it's very important. Again, we know that children can spread the disease as easy as adults can, although luckily individually their chance of getting ill is much less, but they still replicate the same amounts. They can still bring it home. They can still spread it amongst their friend groups into those other people who are at risk. I think it's important to understand that we didn't see a lot of outbreaks or events associated with schools because of multiple factors, and that was distancing, that was masking, that was vaccination of all the adults. So it goes back to that Swiss cheese model and also identifying risk versus benefit. I think it's very important to continue those things in the school, especially since we are so close to the finish line as far as school being out for the summer. We want kids to be well. We want them to be able to go to camps, to be able to go on vacation. So I think it's important right now to continue those things that we have been doing, and that has shown to be safe throughout this past school year.
John, here in our health system, we're still asking people to wear masks.
Absolutely.
And
Absolutely.
one question to you would be this: are we doing it even off-site where there may not be any clinical care being done?
Yeah, all of our buildings, we all mask up. I'll be going back to an HR building today, and for the people that are there, we'll all be wearing our masks, and even when we're in the same, meeting rooms together. So
we haven't made that decision yet that it's A-okay to take all of our masks off. And then the other follow-up question would be this: what's our rate of people being out due to COVID done since we've been vaccinating employees?
yeah, our rate has plummeted to near nothing now. So we have very few employees that are out. We have a couple, but very few. And, I think we're feeling really good about where we are in that journey.
So it makes you feel safe, but remember that you haven't been vaccinated yet, and this applies to a lot of kids. If you haven't been vaccinated yet, you can still carry that virus home. And even though it may feel good to take off the mask, and it does feel good to take off your mask. I like taking off my mask. Just be thoughtful about what's the best, next, most right thing to do. And there's a lot of social pressure, and there's a lot of issues around mental health with children and adolescents, I think, in particular. And so I am sympathetic to the point of a lot of school districts saying we don't want to wear masks anymore. But I also have to ask, are we sure that's the next right, best thing to do for not only that child, but also for all the people that child is in contact with? And I think that's ultimately the question from a medical standpoint, that we have to ask. All right, well, I think it's time to watch some young children not throw away their shot. So I believe, first up, we're going to trade places, Hawkeye.
Okay.
I think you're jumping out of the chair for another Hawkeye.
Yeah.
This is Wyatt. Wyatt, how old are you?
I'm 14.
Awesome. And your dad and you kind of have the same hair, don't you?
Yeah.
Yeah, that's pretty funny.
Fortunately for him.
He has
He's-
more of it.
He's almost as tall as you, too. I was shocked at that.
Yeah. So Wyatt, what do you like to do at school?
I like to, at school,
Yeah.
I like to learn
Okay.
and play sports,
All right. What sport is your favorite?
probably soccer.
All right. Now, Wyatt, you have a little stitch up here above your left eye. What's that
Yeah.
story? Did your dad, did he try to come after you or tackle you or something? What happened to that?
No, I was in a soccer game and I hit heads with another player.
Okay. Well,
Yeah.
that'll heal up in no time.
Yeah.
Well, I think you're about to get a special shot, aren't you?
Yep,
Are you nervous?
a little.
Okay. It's going to hurt. But you know what? Not very much.
Let's
More
turn
like
his
a
chair
bee
just a
sting.
little bit so we can get a full picture.
Yeah.
There we go.
Do you have a preference?
Let's see that arm.
There you go.
That one? Okay.
All right. So Wyatt, thank you for coming in. This is very nice of you to do this. You're a 14-year-old. You're in school. Only you're not here right now. You get to play hooky, so you get a vaccine. Isn't that a thrill? And what's going to happen when you go around school today? What are you going to tell everybody?
I'm going to tell everybody I got vaccinated.
Awesome, awesome. And that way you can make sure you stay safe. You keep all your old folks, your parents safe. Oh, that's a good thing too.
We
huh?
should say a lot of his teammates who have older brothers and sisters who are above 16 have already been vaccinated too.
All
so that's
right.
important.
All right, I'm
And I
not
think
gonna
that
clean
saved
it
a
up.
lot of their
It's just
Their season.
soccer participation and
Yeah.
other sport participations when the whole teams were vaccinated.
All right. You know, Wyatt, my arm hurt for a couple of days, and I felt better. The second time, my second vaccine, I got sick for about 12, 24 hours, and I was fine after that. So, the other thing that came out,
All right, well, I'm gonna
we're going to watch him get
You okay?
vaccinated.
Okay.
All right. You ready? Okay, 1, 2, 3. All right.
Wow, that was pretty quick,
Our
huh?
nurse Bailey covered it up, so we couldn't get to see it. So on the next one, I don't know, we'll have to, I know you got to get in there, so. But
So,
it did happen.
You get a Tweety
Yep.
Bird Band-Aid with it, too.
all right. That's what every 14-year-old boy wants.
All right, there you go. All right.
Wyatt, thank you very much.
Thank you.
Well done. Appreciate you being here on the program to show everybody 14-year-olds should and can and will get vaccinated. And now,
Yay.
Caroline, are you nervous?
A little.
Okay, Caroline, I'm going to do something that's a little off the road here. I promised I was going to sing. Here it is. You ready? Sweet Caroline, bum, bum, bum. You have never looked so good, so good, so good. To COVID-19, you'll soon be saying goodbye, goodbye, goodbye. See? How that? Not bad, huh? Neil Diamond, where are you? Come on. What are you doing out there today?
Neil, if you're around, come on the show.
I don't come on the show. We'll even vaccinate you. Again, if you haven't already been vaccinated, you should have been because you're kind of an old man now. Yeah. All right. So, Caroline, are you going back to school after this?
Mm-hmm.
Are you going to tell everybody you got vaccinated?
Yeah.
Awesome. I think you should. And do you know other 12-year-olds who have been vaccinated? Good deal. Well, I think it's a thrill that y'all are getting your vaccine right here. Thank you for doing that. Thanks for coming in, having to miss part of school. Are you sad about missing part of school this morning?
No, not really.
Not really? Okay. We won't tell your teachers that. Hopefully they're at school and not watching this program right now.
What would you rather be doing instead of in school?
horse riding.
Horse riding. Ah, that's a good answer. Is that your favorite thing to do?
Is that okay? All right.
Cool beans.
How do you place?
So we can turn her chair back then, the other
This
way.
way? Okay.
Yeah.
There we go. So, Caroline, what's your favorite class at school?
Maybe art or science.
Art or science? Those are two good things, you know. I like them both. And what's your favorite show on television?
What?
What's your favorite show on television?
I really like.
Star Trek. Yeah, that's a great choice. Well done.
Okay, I'm gonna go ahead and do it. Okay, you ready?
Heartland.
Enjoy watching that.
Yeah.
All right.
Hey, you get your shot. How
You're
was
done
it?
too.
Very fast.
Did it hurt?
No.
Not really, did it? Yeah, see, pretty good. She's pretty quick.
And you get a Wonder Woman band-aid.
Yay.
Wonder Woman. That's better than Tweety Bird or whatever. Tell your brother you got the better vaccine.
All right,
Better
there you go.
Some of the people watching want to know if the children will have symptoms post-shot like adults do. Do we know?
Yeah, I think it's in less proportions than the adults, yeah, from what I heard and what I've heard and understand.
Yep,
Okay.
and it's kind of a range of it. You may have some shot, you may have some, you may not. Hey, so I want to thank Doc Hawk for bringing his children. Mostly I want to thank his children, A, for putting up with him all the time.
Yes.
And that's a pretty important task right there. Thank you.
Yeah.
And thanks for keeping him aligned. Thanks for making sure he actually gets dressed in the morning. Well done. And second of all, thanks for coming on our program and having that vaccine. Hey, this is National EMS Week. Tomorrow we will continue our discussion on the pandemic's impact on emergency workers on the front lines in the community. Dr. Chad Cannon, Chair and Clinical Service Chief of the Department of Emergency Medicine, and Dr. Ryan Jacobson, EMS Physician Advisor to the Health System, and Medical Director, Johnson County EMS, will share how their work has changed and answer your questions. I'm going to go around the horn really quick, just to ask for final thoughts. First, Dr. Ross.
Well, I just say happy Monday, and be sure to really thank those caregivers that are out there with your children. They've been there since the beginning as well. And so be sure to thank them if you're dropping your children off with them.
All right. Thank you for being a part of our program. John Jaffe, final
Yeah, happy
thoughts.
Monday. Please keep being diligent with everything you do. We still need to keep everyone safe and keep being diligent. We'll all get through this together.
And guys, you guys got to come back, because I suspect there's a whole bunch more HR stuff we need to talk about. Because I
Absolutely.
think
Love to.
that the impact of that on COVID-19 and how it's affected everybody, need to so much more have that conversation. Hawk, final thoughts?
Yeah, I'm so elated that my children were actually able to get the vaccine. I'm happy. It will keep them safe. It will allow them to continue to be participating. We know that, again, school's ending. Get your children vaccinated. It will help allow them to be able to continue participation in this spring, summer, and fall as we move into the next school year. It will keep them safe. It will reduce their risk of having those long-haul symptoms like the fatigue where they just can't get out and do anything, or possibly that multi-system inflammatory disease. There's absolutely no scientific evidence and no truth to the fact about infertility or shedding virus or shedding spike protein. Overall, this is going to be very helpful for them individually, for us as a family and a family unit, as well as for them to be able to continue to get out and do things much like they were doing in 2019, as opposed to the things that they had to go through and deal with in 2020. So please get your children vaccinated. Keep yourself and your family safe.
So Dana Hawkinson, Medical Director of Infection Prevention Control, thank you.
Yeah.
And Wyatt
Thank
and
you.
Caroline Hawkinson, thanks for being a part of this program this morning. We so appreciate it. To all of our guests and to Adam Meyer.
I was just going to say, too, parents can take their 12 and older to South Lake to get vaccinated, as well as can get their vaccine during an established pediatric appointment with us as well.
You may
Okay.
want to repeat that. He wasn't too close to the mic.
You go right ahead.
Oh, okay.
You can take your kids to South Lake and be vaccinated is really what I think. And you can, is it walk-in or by appointment or just by appointment?
By appointment at our
Okay.
South Lake campus.
And you get that appointment by going online, and you can probably just Google Kansas Health System vaccination, and they'll get you the directions to South Lake. And we have open appointments throughout the day.
A lot of them.
All right. To everyone out there, it takes a village, it takes a city, it takes a community, a country, it takes a world. If we want to be normal, we all need to get vaccinated, and that's the way out of this pandemic. We'll see you tomorrow.